Time's now 7:14. A serious illness or injury could leave you unable to communicate or make health care decisions for yourself. Doctors say that's why it's so important to map out what kind of care you would want or would not want in advance. Dr. Brent Wallis from People's Health joins us now with some things that you should be considering today, especially because today is National Healthcare Decisions Day. Dr. Wallis, good morning to you.
Good morning. Thanks for having me.
So when we talk about National Healthcare Decision Day, the idea of advanced care planning comes to mind. Can you kind of tell us what that is?
Yeah, today's really a day where it gives you an opportunity to have sometimes what's a difficult discussion with your family members. So advanced care planning is really an opportunity to lay out what your wishes are for your healthcare needs. So that they can be enacted, especially when you can't speak or do things for yourselves. It's a way to really retain control over your healthcare and your healthcare decisions.
And Dr. Wallis, I understand this is not something that is required, but who would you suggest have these discussions with their family, map this out, and maybe is there anybody you would tell not to worry about this?
Yeah, really, it's definitely not required, but I think everybody should think about this and have those decisions made. You don't really know what's going to happen. You could develop an illness that could progress rapidly. You could have an accident, and you want to make sure that whatever your wishes are, that they're abided by. In particular, with your family, if they have to step in to make decisions for you, you don't want them to have to make those difficult decisions. You want them to follow whatever your wishes are.
And Dr. Wallis, we talk about a decision day or making these decisions, and we talk about something called advanced directives. What exactly is an advanced directive?
Sure. So advanced directives are really just a term we use to describe two different documents that you need when you're doing this planning. So the first one is a living will, and a living will is really it's a document that maps out what you want done for you if you can't tell the doctor what you want at that time. And then the second one that's very important is something called a medical power of attorney. So that's a legal document that actually allows your family members or your friends, whoever you designate, to actually make those decisions for you. And in Louisiana and really all states, it has to be abided by healthcare workers.
And we have about 30 seconds left over. I know a lot of people have had a crazy year health-wise. COVID-19 really showed us how things happen so fast and change so quickly. If people at home are watching this and they decide, okay, now I really want to take advantage of this day especially and make these plans, map this all out, how can they go about learning more information on starting this process?
Yeah, COVID really showed us that things can happen to people even who are younger. So that's why it's so important to think about this now. There's a lot of resources available on the web. Our website, peopleshealth.com/advanced care planning, has a lot of information. And a great website is also something called the Conversation Project. So talk to your doctor about that or go check out those websites. There's a lot of information for you there.
Dr. Wallis, as always, we appreciate your time. Have a good weekend.
Thank you. You too.